Hello there, and welcome to the latest edition of a video from Dynamic Chiropractic Clinic. As always, we're going to do it all in one take. We're not going to go back. Today's lesson is on the cervical disc. If you're watching this video, it's probably because I diagnosed you with a cervical disc injury. Why else would you be on my channel? It only has like 400 people ever seeing things. Probably because I told you. So, what is the cervical disc? Well, the disc is a pad that separates vertebrae from one another. It also holds them together, more importantly, and it's a ligament just like any other ligament in the human body. So the ligaments in our bodies don't have a blood supply, and so therefore they don't have a really good way of healing. We call them avascular, just like an atheist doesn't believe in any kind of God. Avascular means it doesn't have a capacity for healing. And so it's really important that we understand that the damage to the disc is additive and cumulative through our lifetimes. There is a couple pieces of research that say that we can start to rebuild those discs, but I think that's pretty weak to say that we can. So our goal is to take care of the disc as a structural, physical, mechanical kind of issue. And that's where chiropractic and chiropractors like I come into play. So without further ado, I'm going to get into how the cervical disc works. I know it's painful to watch these immature videos, but I want to make sure we get that information out to you guys so that this is not something that we have to sit in the office and talk about each time. I can steer you to this page and you can rock and roll on your own. So without any further ado, cervical disc. So here we are, the cervical disc. If you can see this, great. If you can't, we'll have to redo this whole dang video. The cervical disc is made up of two different parts. One is a goopy center. In Latin, it's called the pulpy center, the nucleus pulposus. And that's what this piece is right in through here and here. On the outside of that, there are layers of rings that are around that nucleus pulposus we call annular fibers or annular ligaments. Annular means yearly, and so it looks like rings on a tree that go around that annulus pulposus or the nucleus pulposus. They usually go in different directions so that our body is better able to handle different loads on top of that disc. The nucleus pulposus is really good at dissipating the force, but if you damage these little pieces back here, namely by bending forward and rotating, which is super common in car accidents and whiplash accidents, and really just from jockeying on a computer, all of those things contribute to the damage of these annular fibers, and when they get damaged, they can push that nucleus pulposus back against where the delicate nerve tissue is that sits behind there. Now, the nerve tissue is organized in the human body very similarly to what we would consider a breaker box in a house. Each one of those breakers in a house goes to a certain area in the house. Same thing's true with our bodies. If we have something that comes out of, say, C5 or 6 or 7 or even the underneath C7, which we call the C8 nerve distribution, those go out to different areas of the hand and down the arm. So this area right here is the C8 nerve distribution, C7 nerve distribution, C6 nerve distribution. Those all tell us what level we might have a problem with. And so people will come in with radiating numbness and tingling in their fingers, these three fingers. That's probably a C6 nerve distribution problem. It could also be a median nerve distribution problem that people have heard of maybe from carpal tunnel podcasts and whatnot. We also have, this also duplicates on the ulnar side over here. So the chiropractor's job as a neurologist is to differentiate between, is it a problem at the disc level or is it a problem at the gang level, the nerve level outside of that? A lot of the tests we do will help determine that as well. One of the ways that we determine that is if you're bending your head forward and that increases the numbness and tingling in your arm, especially if you go off to one side forward or the other side forward and it goes the other way. So if I tilt my head off to, well, this is my left, I would feel it in my right side. That is a really good sign that what we're dealing with is a disc injury. Oftentimes we'll have patients say they've undergone PT care and they've undergone orthopedics care, and they gave them exercises to help build the muscles of the neck. Here at Dynamic Chiropractic Clinic, we don't recommend that because you'll see on this little point right here, there's no reciprocal inhibition in the neck, which means that the muscles on one side may be firing. That means the muscles on the other side of the neck are firing as well. All of those contribute to compression of the disc, which is really a bad thing. We want to avoid compression of the disc, especially in the back where it can push against those delicate nerve tissues. Anytime that we can pull the head off the body gently or extend the neck or we tilt our head back, that's going to take that disc material, and instead of going back against where the nerves are, it's going to push it forward to where there aren't any nerve endings whatsoever. So getting a curve into your neck, getting a stable base for your neck, bringing your chest bone up, absolutely vital. You may hear me say that again and again as well. Some of the treatments we do obviously are traction and extension. We have traction units that we recommend. We have a traction unit review page on this website. But really, chiropractic adjusting is probably one of the best tools that we can come up with. The way that we adjust is from front to back in the neck, which is what we call anterior to posterior. The adjusting we do here is a lot different than what you'll get when you go to any other chiropractic school, because it follows the biomechanics of the neck and allows you to get that springy banana curve that we want in the neck. You know, a banana is a really good example of this. If we bend a banana the wrong way, bending it into the curve, that causes damage into that banana. The same thing's true with you. We want to have a nice smooth curve in our neck so that we're not constantly compressing on top of those discs. By the same token, I want to bring my head forward so that I'm jutting it out in front of everything. If that's the case, it'll shove against those delicate nerve tissues as well. And now on to page 2. This may be a good time for you to stop and write down some of the questions that you might have for me when you come back in next time you come in my clinic. This is the basics of what extension is in the cervical spine, the neck. You can see this person, beautiful, right? That's amazing artistry. But you can see how that puts that banana curve into the neck. We call that a lordosis, and it's really important for us. So if you use a pillow, that's going to be really good for you, but it has to be a kind of pillow that supports that change. And so I do not recommend a memory foam pillow for patients like this. I always recommend the Therapeutica pillow, which is a pillow that is made of regular foam, and that regular foam is always going to resist you. It's always going to force that curve while you're laying flat on your back. Absolutely vital, right? This is going to be bad. If you're laying on a cervical pillow that allows you to adopt that change, memory foam is really probably the biggest indicator of that. It's not helping you at all. It's we call it codependency here in the office, kind of a joke. But really what it does is it's accommodative. And so it allows you to maintain what you have. Accommodation is not what we need in this case. Correction is what you need. And correction means putting that curve into your neck. We do that via traction and extension, right? Traction is simply pulling your head off of your body. Not entirely, we don't do that here. It's a gentle traction that we try and achieve about 10% of the body weight for. So anytime that we can have compression removed in the neck, it's going to be really helpful for you. One of the things that we talk about here that's a little bit kind of voodoo-y is how people breathe. If we find that patients breathe with their upper body and chest, where they breathe like this, they're using their neck muscles to compress their spine every single time that they breathe, which can be hundreds and thousands of times through the day, through the weeks. That constant compression on the disc will eventually decay the disc and cause it to become an issue for you. Normally that happens around C4, 5, and 6. That's where we see the majority of decay in the cervical spine. I think that part of that is because that's where we get the most flexion and extension in the neck, so people get damaged there. It's also where we see the most compression in the breathing cycle. And so breathing with your diaphragm, with your belly, where we have the pressure from the diaphragm go down each time we breathe, that'll push your belly out, means that you're not putting any kind of pressure into the neck at all. This is something that you can do on your own. You can practice this right away. It also gives us a lot more stability in our mid-back and low back. It also moves the kidneys about an inch every single time we move the diaphragm. Theories are out there that say that it helps the kidney function more efficiently because it's putting mechanical input into that kidney. It's worth a shot. So diaphragmatic breathing is also something that we recommend for a patient. And now on to page 3. Monitor height. So most of the patients that come to my office here outside of Seattle, they work on computers. I'd say greater than 50% are computer jockeys. If that's the case, we need to make sure that the setup that you spend at home working on your computer 8 to 12 hours a day needs to be perfect. In my office, we have tables that elevate, we have drops that elevate, we have computerized adjusting, digital x-rays, we have the myovision device. Everything that I do in my office is really designed to help me be more biomechanically efficient. I think the same thing should be true for all of you guys out there as well. So raising your monitor so the center of the monitor is above, above eye level is really important. If we can get that above eye level, that's going to force you to lift your head up a little bit more each time. And when you do, that forces extension in the cervical spine again. Pretty straightforward stuff. We always say you should have your chest bone up to the ceiling, because if you do, that means that you're bringing yourself into extension. You're flattening those upper thoracic spine vertebrae and enabling yourself to come back over top of your body again. We don't want you in what we call the C-spine shape working on your computer, or even if you're at a different kind of job. Bending forward for long periods of time is bad for the disc. Flexion and rotation combined, bending and rotating, terrible. Extension and traction, great. You gotta try and keep it simple. So we try and keep people away from the C-spine shape and slowly move you towards the S-spine shape, where we can avoid all the shock and loading on top of our back. Having this ears over top of the shoulder, over top of the pelvis, is an ideal situation. That's where we have a coiled spring that we can adopt all those shocks that we have in life. Again, balance is going to be the key, right? So can you be doing things where you do bend forward and you look down and read your phone? Absolutely. Can you go fishing and still look over the side of the boat? Absolutely. The balance is what we want to talk about, is how do we get you to go from a flexion-based spine to an extension-based, easy for me to say, extension-based spine. If we can get you to drive your chest bone up, bring that head back over top of your body, chiropractic adjusting to pull your head back over top of your body, these are the things that's going to help you out. Getting onto a cervical pillow. These are all pretty non-invasive things that can keep you from losing your grip strength in your hands, which is when we will probably send you out for an MRI. MRIs show the discs in every form, in every shape, in every plane. They can also show how much water is still in those discs. If there is in fact a problem, we'll see that on the MRI. If it is pushing on the motor side functions, or maybe I'm weak in these three fingers on both sides, that means that we're going to send you out for an orthopedic neurosurgical consult. We deal with a lot of people, especially with the UW physicians. We're really a big fan of the University of Washington, to get you set up for an orthopedic neurosurgical consultation. Obviously, in Dynamic Chiropractic Clinic, we want to keep you here in our house, try and get you taken care of with non-invasive techniques before we start to go into something more major medical, which can also have side effects. We don't want that. Surgeons don't want to do that. They refer to us because they want to have somebody try out the care before they do. I'd say we're pretty successful with the patients that come to see us. Because we have a very straightforward focus as to what we're saying and what we're doing, there should be a very congruent line between those two pieces. Very rarely do I ever find a patient question me on what we're doing or why we're doing it, because we're super clear on what's happening in the office. I'm sorry this has happened to you. I don't want to be the person to give you this diagnosis, but it's better that you get it early so that you can reverse the problems before they become bigger and bigger. So here at Dynamic Chiropractic Clinic, we're willing to answer any questions you might have to ask, and we're here 4 or 5 days a week. If you have any questions about what we've talked about, please write them down, bring them to our office, email me. If you have my cell phone number, you can text me, and we'll get you taken care of. Information is the key for this. Managing what you do with your life outside of it, it's really important. We want you out there telling everybody how great our care is, how wonderful the care at Dynamic Chiropractic Clinic is, and that you're getting better. That's what's built our business over the last 25 years. That's what's going to keep it going for the next 25. So I hope this video was a little bit helpful for you. I'm sorry about the low presentation value on the cardboard, but that's the best I could do on a first night. So hope everything's going well for you. Take care and be good.